Welcome. Today we shall be looking at physiological changes in pregnancy. During pregnancy, a woman's body undergoes various changes, both physiological and anatomical, necessary to meet increased metabolic needs in order to support the growing fetus for its harmonious development and also to prepare the body for birth. It has been observed that the first changes appear during the first trimester of pregnancy and they intensify once the final term is reached and return to normal weeks after birth. These changes serve to support a growing fetus and maintain a maternal balance. A strong grasp of these transformations helps us to avoid clinical misjudgments and enables proper management of pregnant patients. The major changes during pregnancy occur in the reproductive organs, the endocrine and metabolic function, cardiovascular and hematological systems, as well as respiratory, renal, gastrointestinal, and dermatological systems. Each of these adaptations plays a critical role in sustaining both the fetus and the mother throughout pregnancy. Let us focus on the changes based on the systems. In the reproductive system, the uterus undergoes remarkable growth from around 50 grams pre-pregnancy to nearly 1,000 grams at term. This growth results from both an increase in cell size known as hypertrophy and an increase in the cell numbers known as hyperplasia. It also undergoes structural segmentation into the upper and lower parts, and as well, the muscle layer adaptations occur to support fetal development. In the cervix and the vagina, the cervix becomes softer and edematous, forming a mucus plug, and then cervical ectropion occurs due to estrogen effect. The vagina mucosa thickens, with the pH becoming more acidic, ranging between 3.5 to 6.0. In the vagina, estrogen-driven glycogen pump builds up, leading to an increase in acidic pH, favoring a lactobacilli and protecting against infections. Breast enlargement is common, particularly in the first pregnancies, due to ductal and alveolar growth. The areola darkens, the Montgomery's gland enlarge, and the colostrum, which is an early form of milk, may start to appear by the 12th week of gestation. The estrogen, progesterone, and prolactin are the key hormones at this time. The common skin changes in pregnancy include a pregnancy mask or a cloasma gravidarum, the linea nigra, which is a dark abdominal line, and a stria gravidarum or stretch marks that occur due to dermal stretching. This stria gravidarum can occur on the abdomen and the hip region. On average, women gain between 10 to 12 kilograms during pregnancy if they're having a single pregnancy, and this includes fetal weight, an increase in fluid volume, and fat stores. Excessive or inadequate weight gain should prompt evaluation for conditions such as preeclampsia, intrauterine growth restriction. When looking at the blood volume and hematological changes, the blood volume increases by up to 50%, primarily due to plasma expansion, which results in physiological anemia. Although the red cell mass increases, the plasma rise dilutes hemoglobin and hematocrit, causing physiological anemia. An elevated white blood cell count and fibrinogen levels are also expected in pregnancy. Pregnancy creates an hypercoagulable state to protect against postpartum hemorrhage. However, this also elevates the risk of venous thromboembolism, which is a key point to monitor clinically. In the cardiovascular system, the cardiac output increases by 30 to 50% and peaks between 22nd to 28 weeks of gestation. The heart rate increases by 10 to 20 beats per minute, with an increase in the stroke volume of up to 10%. The mean arterial pressure reduces by 10 millimeters of mercury, and physiological murmurs may be present during auscultation. These mothers will experience supine hypotension syndrome, Under gravid uterus compresses inferior vena cava, reducing the venous return, therefore causing hypotension and syncope at times. To manage this state of supine hypotension syndrome, we need to ensure our patients lie on the lateral side or lateral positioning. In the respiratory system, progesterone increases sensitivity of the respiratory center to carbon dioxide, causing mild hyperventilation. This aids in efficient oxygen exchange for the fetus, and the lung volumes change slightly due to diaphragm elevation, but the respiratory mechanisms remain intact. Therefore, the respiratory rate and tidal volume increases, the minute ventilation increases, the ribcage diameter also increases by 2 centimeters. In the renal system adaptations, the renal plasma flow and glomerular filtration rate rise significantly, leading to a mild glycosuria and proteinuria, which are generally benign. Ureteral compression can also cause mild hydronephrosis, especially on the right side. This is due to mechanical ureter compression. The glomerular filtration rate is seen to increase by up to 50%, with the renal plasma flow increasing by 50 to 80%. In the gastrointestinal system, the smooth muscle relaxation slows down the gastrointestinal motility, leading to constipation. A relaxation of the lower esophageal sphincter may cause a reflux, and a gallbladder stasis increases the risk for gallstone development or cholelithiasis. In the endocrine system, the placental hormones, for example, human chorionic gonadotrophin hormone, progesterone hormone, and estrogen hormones dominate during pregnancy. The thyroid binding globulin increases, therefore increasing the total T3 and T4 levels in blood, and an insulin resistance as well increases, leading to a development of a diabetogenic state. The placental hormone, over human chorionic gonadotrophin hormone, acts as a signal of pregnancy and stimulates progesterone release. With progesterone presence, there is an increase in uterine relaxation, placenta growth, and breast development. Estrogen hormone is also responsible for uterine growth, labor preparation, breast development, and fetal development. And lastly, relaxin hormone is responsible in inhibiting contractions and relaxing the pelvic joints. Pregnancy is known to shift the immune system towards a humoral-dependent profile to tolerate the semi-allogenic fetus, leading to an increased susceptibility to infections, particularly urinary tract infection. In the neurological and musculoskeletal changes, pregnancy is known to alter posture, leading to development of lumbar lordosis due to fetal weight. Ligamentum laxity can as well develop, causing joint pain, and compression neuropathies are also a larger complaint in pregnant females.